Hi everyone, this is Dr. Hall. We're continuing on with our lecture on non-STI genitourinary infections. Moving into part B, we're going to talk about urethritis, urinary tract infections, and epididymitis. So urethritis, as you would imagine, is irritation and inflammation of the urethra. So the urethra can get infected by bacteria. In male-bodied people, often STIs will present as a urethritis, meaning those are the symptoms that it will manifest or that will show up. But other things can also cause urethritis. So non-STI bacteria that get inside the urethra can also cause urethritis, as can irritants. I've sometimes seen people who were overzealous with hygiene and soap and have actually gotten some soap worked up inside the urethra, and that can be very irritating. So urethritis can be caused by a number of different things: STI bacteria, non-STI bacteria, as well as local irritants. And it's going to cause pain in the urethra, and that usually manifests as a burning type of pain with urination. So a stinging or a burning as the urine travels through that inflamed area. If it's severe enough, or as frequently happens with urethritis caused by an STI, you can also get some pus dripping out of the urethra. So here's an example of some purulent discharge, some pus coming out of the urethral meatus in an uncircumcised male-bodied person. So urethritis can be caused by a variety of factors, causes pain with urination and sometimes discharge from the urethra as well. The treatment is almost always going to be antibiotics if it's an infection. If it's due to a local irritant, then just removing that irritant. Okay, so here is all that information, right? So it's infection or inflammation of the urethra. In male-bodied people, it's most commonly caused by STIs. When we talk about UTIs more broadly, we'll talk about what we tend to see more in female-bodied people. It can be caused by non-STI bacteria and by irritants, right? So soaps or other body products. Causes burning pain with urination, sometimes a little bit of blood in the urine, and some discharge or pus from the urethra. And the treatment depends on the cause. Most commonly, the treatment is going to be antibiotics to treat either an STI or a non-STI bacterial infection. And there's that lovely picture again. So cystitis, or a UTI, is an infection of the bladder. So first off, these are much more common in female-bodied people. And the reason for that is that the genital skin, the skin out here, normally has bacteria on it, right? It's pretty close to the anus, and the large intestine has all kinds of bacteria in it. So there normally is bacteria present on this skin. And then with any type of rubbing or friction, such as often occurs with sexual activity or can sometimes occur with bike riding or horseback riding or some other things, it's easy for those bacteria to get pushed up inside the urethra. Now, in a female-bodied person, the urethra is only a couple of inches long, and then the bacteria can get up into the bladder, which is paradise for bacteria, and they can grow and multiply and cause a full-on infection. So in male-bodied people, the urethra is much longer. It's about 7 to 8 inches long because it has to travel through the entire penis and then up through the prostate and into the bladder. So in male-bodied people, the non-STI bacteria that often cause cystitis or UTI in female-bodied people, they have so much longer to travel that either the person urinates and flushes everything out before they have a chance to get up into the bladder, or their immune system is able to take care of them during that long, arduous journey to the bladder. This is not to say that bladder infections can't happen in male-bodied people. They do sometimes occur. They are just much less frequent than in female-bodied people. So again, I just want to highlight that because the vulva also is very close to the rectum, which is a source of lots of bacteria, that is another reason why female-bodied people are at increased risk. Not only is their urethra shorter, but they have a higher bacterial count on the skin around and near the opening of their urethra. So what happens if you get a bladder infection or a UTI? Well, if you have gotten this infection, it has also infected your urethra. So you can also have the same symptoms from urethritis, so namely dysuria or that burning pain with urination. You can also get symptoms due to the infection in the bladder itself, that cystitis. Things like feeling like you have to go to the bathroom really frequently. The bladder is irritated, inflamed, it doesn't want to have to hold the urine, it wants to empty as soon as anything starts to build up. So we call that frequency, having to go frequently. Also urgency, when you feel like you have to go now, right? You can't wait till class is over, you can't wait till this video is done. You have to get up and go to the bathroom now because the bladder just can't hold it. Sometimes you can also have blood in the urine, as was mentioned earlier, and that's called hematuria. The way we can diagnose a bladder infection is by doing a simple test of the urine. And we can see blood, we can see white blood cells, we can see a number of factors that tell us that this is an infection. And the treatment then is antibiotics. There are over-the-counter medicines that are sold to help treat the symptoms of UTIs. So they're, for example, Azo or Urostat or some of the brand names that you can see. Those medicines numb the bladder. So they treat the symptom, they make it feel better, but they don't treat the actual infection itself. So that's an important thing to realize. It's like taking, Tylenol for strep throat. It'll help the pain of the sore throat, but it doesn't actually make the strep infection go away. Same kind of thing with UTI and those over-the-counter medicines. Increasing fluids can help kind of wash the bladder out by just kind of flushing fluids through. So that can help. And a lot of times people talk about drinking cranberry juice. So the thing about cranberry is that if you have an infection, taking cranberry supplements or drinking cranberry juice has not been shown to be more effective than just drinking lots of other fluids. There's no evidence to support the use of cranberry for treatment of a urinary tract infection. There is evidence to show that taking a cranberry supplement or eating cranberries regularly can help prevent a urinary tract infection. But if it's already developed, then if you don't like cranberry juice, you do not need to drink cranberry juice, okay? So don't worry about that. So this is a bacterial infection of the bladder. It's usually the typical bacteria that are normally present on genital skin. They just kind of get worked up into the urethra. Much more common in female-bodied people because their urethra is so short and because their opening to the urethra is relatively close to the anus, so there are a lot of bacteria in that region. Other risk factors are rubbing and friction, right, that kind of push the bacteria into the urethra. Symptoms, we talked about pain with urination, blood in the urine, feeling like you have to go frequently, feeling like you have to go right away, and sometimes also some lower abdominal pain from that irritated bladder. In order to diagnose this, we can do a urine test. Sometimes if people have had these before and they say, oh, this feels exactly like one I've had before, we'll often just treat based on symptoms, sometimes over the phone or via an electronic visit, and people don't have to come into the office. The way to cure the infection, oh, hi Kat, is to use antibiotics. And so usually it's just for 3 to 5 days. They usually work very well. We can use some bladder numbing agents to help treat the symptoms, but remember they don't actually treat the infection itself. Cranberry can help to prevent them, but won't treat an existing infection. And drinking fluids can help to flush things out. So an important preventive tip here is after any sexual activity or any kind of friction or rubbing on the vulvar area that might push bacteria up inside the urethra, it's important to go urinate because that just kind of rinses everything out and flushes it out. So after intercourse, no matter how much you might just want to curl up and snuggle up and fall asleep, it's actually really important to get up and go pee and flush things out. Now keep in mind, because of the engorgement of the erectile tissues of the vulva, both the clitoris and the vestibular bulbs, it can be very difficult to urinate immediately after sex, so you might need to give it a few minutes. Just be careful not to fall asleep and miss your opportunity. So sometimes that bladder infection the bacteria can actually end up moving through the ureters, which are these tubes that normally bring the urine down from the kidney, because the kidney is what makes it. So sometimes the bacteria can actually climb up through those tubes and get into the kidney and cause an infection of the kidney. That is called a pyelonephritis, and that can be a much more significant infection. So in addition to the symptoms of a cystitis or a UTI, which we discussed earlier, you can also get back or flank pain, nausea, vomiting, and fever. And so this is a more serious infection. It's kind of more deeply inside your body, and so oftentimes we'll need to treat these with a much longer course of antibiotics, or sometimes they can be severe enough that people need to be in the hospital or getting IV antibiotics. So we want to avoid this happening, which is why we generally want to treat a UTI if it develops in someone, rather than have them, for example, just use the over-the-counter medicine to make it feel better and hope it goes away on its own, right? We want to avoid this complication. So here's that information, right? It's just a progression of the infection from the bladder up into the kidneys with additional symptoms such as fever, back pain, nausea, and vomiting, and it's going to require more intensive treatment, sometimes just longer-term antibiotic pills, but sometimes IV antibiotics and or hospitalization. The last infection we're going to talk about for this section is epididymitis, which, as you can imagine, is inflammation of the epididymis, which you'll remember is that coiled tube that sits on top of and behind the testicles. It's the place for the sperm to go to finish maturing and await an ejaculation. So sometimes an infection that enters through the urethra can come all the way up through the vas deferens and get down into the epididymis. So epididymitis, inflammation of the epididymis, can occur. It is most commonly caused by STIs, but can occasionally be caused by other types of bacteria, those kind of bad luck bacteria. So that's why we're also talking about it here. Symptoms of epididymitis, as you can imagine, would be pain and swelling and sometimes some redness of the affected area. Most people who have scrotum aren't too savvy to know the difference between testicular or epididymal pain, and that's fine. So they'll often present with pain in one or both sides of the scrotum and tenderness to touch. So we can diagnose this based on exam. We'll usually do STI tests because, again, STIs are the major cause of epididymitis. But again, sometimes it can be caused by bad luck bacteria, and the treatment for this is going to be antibiotics. So to review, right, this is inflammation or infection of the epididymis, usually caused by STIs, but can be caused by other kind of bad luck bacteria as well. Causes testicular or scrotal pain and swelling. And just to point out here, sometimes it can be difficult to tell when somebody presents with a red, swollen, painful scrotum, or half of a scrotum, one side, whether it is epididymitis or whether it is testicular torsion, which you'll remember is a medical emergency where the testicle twists on that spermatic cord, therefore kind of kinking off the blood supply to and from the testicle. So oftentimes if epididymitis, is severe, we'll do an ultrasound with a Doppler flow study to check and make sure there isn't torsion. So to make the diagnosis, we'll do an exam and do lab testing, and the treatment for epididymitis is going to be oral antibiotics. Sometimes antibiotic injections are necessary too, depending on the cause. So, urethritis is that inflammation of the urethra in male-bodied people, usually due to an STI, sorry for the typo, but can be due to other bacteria or irritants, causes pain with urination and sometimes discharge as well, like that pus dripping out of the penis. Treatment is going to be antibiotics. UTIs are a bacterial infection not usually caused by STIs of the bladder and urethra that cause that same pain with urination as well as frequency and urgency and sometimes blood in the urine. The treatment is antibiotics to treat the infection and sometimes meds like azo to help with symptoms. And we want to avoid it going up into the kidneys, right, because that can become serious. Epididymitis, inflammation of the epididymis, is usually due to STIs but can be due to other bacteria sometimes, will cause pain and swelling of the epididymis, and the treatment is antibiotics. So next we're going to venture into, in 23C, we're going to talk about vaginal infections.